And I'm live. Well, welcome to another episode of Mondays with Miko. And I could not be happier today. I am actually joined in the green room is a magnificent panel. And this panel, we're here to have a discussion about about COVID-19, right? And vaccinations. And you guys all know that I've been in this space, and I promise you that I'm going to bring experts to the table. And that's what we have today, y'all. We have a virologist at the table today. We have a nurse practitioner. We have somebody in the nonprofit space that's working on social care and outreach. We have just five, well, not including me, four really great experts that are here to answer your questions. And then hopefully we can just have a real conversation and start to debunk some of the myths around the vaccine, the virus, what it means. So if you happen to be, I'm going to go ahead and share, but if you're watching this on replay, thank you so much. Remember, you can still share it. You can still share it. Hello, Gail. How are you? We do want to take your questions, right? So we want to take your questions and answer your questions live. But it would mean that you guys really need to be on the Friends of Miko Picket page. So if you're watching this from one of my other pages, my personal page or Time for Change or another page, I'm going to ask you to please hop over to, if you want to participate live, where you can get your questions answered live, go ahead and hop over to the Friends of Miko Picket page, and that way I can see your comments real time, okay? Because I hate to miss your real-time comments. If you are joining us on the replay, feel free to ask your questions, and then I do go back periodically after the shows and watch again, and we'll get your questions addressed. And also, if you have questions, and most of you guys know this, if you have questions at any point, feel free to inbox me, text me. Let's just go ahead and continue this conversation. And so without further ado, I'm going to go ahead and bring on the panel, y'all, because I don't want to waste any time here. And here they are. Hold on a second, I'm going to take them all off mute. Hello, guys. Welcome to Mondays with Miko. So I am going to go from the middle box on, and I'm going to let them introduce themselves. And then we'll go ahead and get into the questions and answers. And I have some pre-set up questions to ask this panel of experts, but I could not be happier for you guys coming on this Monday afternoon to address the community. And we're going to talk about the myths as well as the facts as it relates to Delta and COVID-19. Hey, Cheryl, how are you? All right, so let's go ahead and start with Miss Tiffany James.
Hello, I'm Tiffany James, and I'm the director of Zero COVID SC Coalition here in South Carolina, and been working on COVID response for over a year now with my friend Jeremy Rossman, and also working with Miko Picket on this issue as well. So thanks for having me.
Yes, thank you so much, Tiffany. Dr. Jeremy Rossman.
Hello, it's nice to be here. I'm Jeremy Rossman. I'm a virologist with the nonprofit organization Research Aid Network, and I've been researching viruses that cause epidemics and pandemics for about the past 20 years, looking at how the viruses cause disease, how you can work with the immune system and vaccines to help protect people, and how you can respond at a community level. So it's nice to be here today.
Thank you so much. And for now, I got a practitioner. Let me bring her back on. Marek Calhoun.
Hey, how you doing? My name is Marek Calhoun. I am the Director of Social and Community Services for CARE South Carolina. CARE South Carolina is a federally qualified health center Here in the PD region, we cover Darlington, Marlboro, Dillon, Chesterfield, and Lee counties.
Awesome. Awesome. Thank you so much for joining the show. And last but not least, nurse practitioner Almeda Graham. Nurse practitioner Graham. All right. Well, we'll let her, you know how technology goes, y'all. Even the best laid plans. Hello, Sandria. Thank you for joining. I appreciate you for joining. So, hey guys, today we're here to talk about the COVID-19, the Delta variant, and what all this means, right? Because it's a lot. Would you guys agree that it's a lot for just a layman to try to keep up with what the CDC says, what's FDA approved, you know, kind of, especially with all of the myths that are out there. So I'm going to go ahead and start off with Dr. Jeremy Rossman. Can you talk to us? What is a variant and what makes Delta different than what we experienced last year?
Certainly. So every time the virus infects somebody, it changes just a little bit. And so, you know, the more people that are infected, the more of these little changes occur. Now, normally, these little changes don't really do anything. It's like you make a photocopy of a document and there's one tiny letter off. The meaning is still the same. You can see what was meant. But if you do that enough time, you get enough mistakes, things start to change. And sometimes, and that means that the virus and how it behaves, how it spreads, or how it causes disease can actually change. And that's where we start to get these variants of concern. A variant is just a virus that's changed a little bit. And so a variant of concern is one that's changed in a way that it's starting to affect how the virus behaves in a way that's making us concerned. And so Delta virus is one of those variants. It's changed a little bit from the previous versions of the virus, and it's changed in a way that we're starting to be concerned about it. So we've had a lot of variants. We're still going to have a lot of variants. Delta is one of many, but it's a variant that's spreading very widely throughout the world right now.
Okay. And so I'm going to actually thank you so much for that explanation. And if I can kind of summarize it a little bit, if we look at the Delta variant, is it that it's replicating faster? Is it more contagious?
Right. So there are two reasons why we're concerned, why the Delta variant is a variant of concern, why we're all talking about it and hearing so much about it. One is that it spreads better from person to person. So it's 60% more transmissible than the Alpha variant. And the Alpha variant was even more transmissible than the original strain. So that just means if you're exposed to somebody, it's a little bit easier for the virus to pass from person to person. So, you know, if you still have good precautions, if people are vaccinated, that's still just as effective. But if you're, say, in an indoor space and maybe somebody isn't wearing a mask, it's just that much easier for the virus to spread to another person. The second reason is that this variant is starting to evade the protection of the vaccines a little bit. It's just a little bit. It's not like the vaccines don't work. It's not like, you know, we're running into a problem where people that are vaccinated are going to get seriously ill. No, the vaccines are still really good. But what we're starting to see is that the vaccines are a little bit less effective at preventing people from getting COVID at all. And so some people are getting what is being called breakthrough infections, where you do get COVID and very mild disease, but the vaccines are still really good at preventing people from getting critically ill.
Okay. Well, thank you for that. And hello, Cynthia. I see you joining. I hope you're feeling better today. So, Tiffany, can you talk to us? What's the current state of vaccination percentages in South Carolina? And do you have any other information about vaccines as it relates to kind of the demographics demographics in South Carolina?
Yes, I have some information for you. I don't have any demographic information, but I do have like the percentage of people who are vaccinated, fully vaccinated in South Carolina. And so we have 43.8%, according to the DHEC website, 43.8% of South Carolinians who have completed vaccination. And we have, let's see, about 49% who have at least one shot. So, yes, 49.7% has at least one shot. So, we are moving up slowly but surely, but, not fast enough, for me. So, that's,
Really not fast enough for any of us, right?
yeah,
Because, Mayor County is at 38%. And if we need to get to 70%
yeah.
herd immunity, we're much farther behind some other states, right?
Yes, we're definitely in the bottom tier of vaccinated states, for sure. I don't think we're the last 5 states, but we're in the last 10 for sure. And we definitely have some work to do. We have some on the ground work to do to get people vaccinated, and not just that, just in informing people and holding their hand, really, because there's some people who do know about the vaccines. They know about they have access to it, but there's still that fear, right? So, I'm hearing from people across all social and economic levels, from rural areas to urban areas, from East Coast to West Coast, the same fears. And one of them is amongst women, women between the ages of 20 and 40 who are having children. So the fertility issue is, that's something that we need to debunk. The fertility, I guess, miscommunication about that, and about how the vaccine interferes with that, and it does not. So we just have to really instill confidence into people, and to let people know that there are people who are vaccinated and pregnant. There are people who got vaccinated before they got pregnant, and they're not having any complications, and they're able to, bring a child into this world with no problem. So I just think that we need to see more examples of that, and more people who are trying to have kids, or who are having kids, who are saying, I'm vaccinated and I'm okay, right? So it just takes a lot of people, a lot of influencers, stepping up to get the word out. And that's our work, right? Our work is to get the influencers, find the influencers in different sectors and in different different areas of society, and educate them in order to reach their network.
Yeah, and you know
Yeah.
what? And that kind of is right up your alley, Marek, as the director of social and community engagement. You're out there in those streets. So Tiffany talked about hearing people say, "Oh, if you're pregnant, or you're a woman and you want to, conceive, that's an issue." What else are you hearing out there in them streets, Marek?
Oh Lord, you hearing everything from it alters your DNA, to it's the mark of the beast, to it's I don't know what's in it. They made it too fast. I mean, you hearing from this side to this side, like she said, all types of myths that are out there about why there's an issue with taking the COVID-19 vaccine. I mean, it's safe.
It's
I mean,
sick, but
it's safe.
but we got to, because I understand people's concerns, right? And so some of them things are just crazy, like just crazy. that that you're gonna put something in your body and track you, and then it's the metal lady saying that if you get vaccinated, then metal will stick to you. All that being said, the last one you mentioned, Marek, it was about how this happened so fast. right? How did they come up with this so fast? So I'm going to jump that over to Dr. Rossman. How did they come up with this vaccine so fast?
It was an incredible achievement. So, first of all, it's not that this technology was just created for the pandemic. We've been working on mRNA technology for a decade. So this has really been the right time to be able to use this technology. It wasn't just the sudden creation of this, but of course, we never had an mRNA vaccine before. So this is a new use of the technology. But we were able to use it and evaluate it and know that it's safe and effective so fast. First of all, because the majority of the world's biomedical research infrastructure was devoted to, drugs and vaccines and therapeutics and clinical diagnosis for COVID. So we had more resources pooled into this effort than we've ever had for any other single time, any other single research effort. But also, the clinical trials went so much faster than they have in the past. And that's not because any shortcuts were taken, but because when you're evaluating how well something like a vaccine works, you give somebody a vaccine or a control, and then you see who gets infected and if the vaccine in fact worked. But because of that, you have to wait to see people get infected. And so if you're in the middle of a pandemic, you have a lot of cases of COVID. So you get that data really fast, not because any shortcuts are taken, but because we just have so many infections that we actually get that data so much faster.
Yeah, that makes so much sense. Unfortunately, we had so many deaths in the USA, right? Wasn't it well over 500,000 people?
600,000.
600,000 people. Oh my God. So, you heard Dr. Rossman. He is in this business. He is a virologist. And we said we're going to bring experts to the table. And the experts said we were all working on it. This has been around for 10 years. This is not anything new, right? So thank you so much for sharing that. Wait, nurse practitioner, yes. Okay, cool. She's on her way back in, so we can get her into this conversation.
Hi, everybody.
Hey.
Sorry about my technical difficulties.
It happens. It's the world we live in today, right? It's a world where vaccines, a pandemic can come up, and very, very intelligent, bright virologists and scientists and doctors could go in the room and come out with a vaccine, right?
Yeah.
So I mean that is good, right? And so we do have to listen to the experts, folks. We really, really do. So let's talk about some more myths. So one of the myths that I hear people say is they don't believe in vaccines and they don't take vaccines. What do you say to that, panel? Let's start with Nurse Almeda.
Well, some people don't believe in vaccines. There has been a stigma with vaccines ever since they've been trying to connect vaccines to autism. So a lot of parents have problems with vaccines anyway. So therefore, when a new vaccine comes up, it's going to be a definite no. It's going to be a definite no to some parents.
And I kind of get that. And Dr. Rossman, you may be able to speak more to it, but we're not striving for 100%, right? We're trying to get to 70% so that we can get to herd immunity. Right now, in my county, we're at 38%. So maybe it accounts for some kind of hesitancy. But where we're at right now is really at a danger for our community. How about you, Tiffany?
No, I'm hearing so many different things. And I think Merrick, he said a lot of them, really. A lot of people think they're being injected with things.
Well, let's talk about specifically other vaccines. It's my that you're about to take a trip.
Yeah, other vaccines. So I recently got a yellow fever vaccine, and because I'm going out of the country, going to Ghana. And when I got the vaccine, I had more of an effect with that than I did with COVID. The COVID-19 vaccine. So like when I had my Pfizer shot, the first shot I was fine. I just had a sore arm. My second shot I was fine. I just had a sore arm. Like I wasn't tired. I wasn't sick. I wasn't down for a couple days. I even planned my day to be down, and I was not. I was not. I was totally fine. And so with the yellow fever shot, I mean, I don't feel bad, but I have a bruise, and I didn't even have a bruise with the COVID-19 shot, right? I'm like, I have a bruise, and the site itches a little bit, and it's a big lump, right? And I'm like looking up side effects, and I see that is some of the side effects for yellow fever, but I'm like, this gives me more concern than the COVID-19 vaccine. But it just goes to show that everything has a side effect, right? Everything has a side effect. Even Tylenol has side effects. Everything has side effects. I mean, we can't prevent that. So I think the best thing is to do what we can to prevent catching these infectious diseases. We can't prevent side effects, but we can definitely do what we can to prevent the catching viruses. So,
having 4 kids that all went through school, they could not go to school. Now, I get what you're saying, the practitioner Almeda about, people that are anti-vaxxers, and I get it, and I don't know how they handle school, but, the school my kids went to wouldn't let them in, and my kids had to be vaccinated against polio, measles, mumps, and rubella. They had to have tetanus shots, right?
Mm-hmm.
So when people say they don't believe in vaccines, and I'm sitting there looking at you, and you're telling me that you went to public school, I'm like, that's not true.
Yeah.
That's not true. You're full
Right.
of vaccines.
They have a clause with getting vaccines. As long as physicians say that you can't get them for some reason, then you don't have to get it. That's where there's a little clause there. And that's where a lot of the kids slip by who don't get the vaccine. So that's how they get into school. And it makes everybody more susceptible to catching something because they don't have the vaccine.
Right. But
now see with COVID, with COVID, there's not many exemptions as to why you can't take the vaccine unless you had a reaction to something in the vaccine or had a reaction to a previous COVID test. Other than that, you can be immunosuppressed. You can be pregnant. There's no reason why they'd rather you get the vaccine than take the risk of dying.
Wow. And so you would see them. So for those of you who don't know, Tiffany and I are part of the We Care Coalition, and we host monthly vaccination clinics in Marion County. And Nurse Almeda is the nurse practitioner. She's the one who walks in the door with the vaccine. So Nurse Almeda, you see them on both sides, right? You see them. I mean, hopefully we can prevent it with the vaccines. But if somebody comes to you with COVID, can they get the vaccine then and stop the disease progression?
Well, no, they can't get the vaccine then if they have COVID. The process of disease has to take place to see if they're going to need the plasma or the remdesivir, something to see how their body is going to react to the disease. After 2 weeks, they can get the vaccine. After they're free of it for 2 weeks, then they can get the vaccine. And if they've had the plasma or the remdesivir before, they have to wait 90 days after they receive it, 90 days before they're able to get the vaccine.
Oh, wow. Now, from Marek, compare South, are you guys still offering the whole M procedure? What's it called?
Monoclonal antibody.
Monoclonal.
Yeah, we do.
You guys are still offering that?
Yes, ma'am. So far.
So if somebody happens to get COVID and they were not, even, I guess it doesn't matter, vaccinated or not, they get COVID. Can you talk to the folks? What is that treatment about? And where do you guys have that treatment?
So we administer that treatment here at our Hartsville site in Hartsville, South Carolina, at the Care South here. It's done via IV therapy. We have an IV therapy lab here, and our nurse practitioner Jennifer Lynch, she's over that program. And if someone tests positive for COVID-19, they certainly can reach out to her and her team, and they can speak with them to see if they're eligible for the treatment. I think so far now we've administered the treatment to about 320 people. And we're getting folks from throughout the PD. We've had folks come from as far as Columbia, Greenville, although there's there are areas up in that area for them to partake. But we've treated quite a few people.
So what's that called again? Because I mess up when I say it.
Some monoclonal antibody treatment.
Monoclonal antibody treatment. So, folks, we want you to be vaccinated. That's why we're on the show today. That's why we host the vaccination clinics. But if for some reason you don't, please, and you get COVID, they need to get that treatment like right away, right?
Absolutely, and I'm sure Dr. Rossman he can speak to its benefits a little bit better than I can because I'm not clinical, but I can tell you that we're getting referrals from providers all throughout the PD. I can't speak for how many folks are in the PD area that actually do it, but we are one of the if not the only FQHC in the area that carry the monoclonal treatment. So
That's awesome. Can I jump in for just a second? My grandmother had COVID, her and my aunts. And so two of them, my grandmother and one of my aunts, received the monoclonal antibody treatment. And I was able to tell them what it is and to ask the doctor for it. So, and that just shows the importance of us having the information, not only just about vaccines, and not only just about testing, but about how do we care for ourselves and others if we happen to get happen to get COVID, whether we're vaccinated or not. So yes, I'm really am glad to hear that your FQHC has the monoclonal antibodies. It's definitely saving lives.
Yeah, that's what we're about, getting the message out and saving lives. So there's a question that came in from Cheryl Bailey, and she wants to know, if you're fully vaccinated, do you still need to do COVID testing? Anybody on the panel, please.
I would say yes if you're showing symptoms. If you're showing it, I suggest you get COVID testing because the vaccination is supposed to make the symptoms, make the recovery better if you get it. It's not a guarantee that you won't get COVID again. So if you're showing symptoms, it's always best to get a COVID test.
Absolutely. And, we now know with Delta variant going around that there's a greater chance that even if you're vaccinated, you might still get infected. And again, you're really well protected from severe disease. But if you get infected, you have to remember that you can still spread it to other people. And with a large percentage of the population that's still unvaccinated, that means that you can spread it to other people and they might be at risk of severe disease. So to protect the rest of the community, it's still really important to make sure that, like, if you have an exposure or if you have symptoms, even if you've been vaccinated, testing is still really important. And testing still works. Even if you're vaccinated, the tests still work.
Wow. And so that I don't know why, but for some reason it just clicked. So here I am. I am fully vaccinated, so I'm so confident about myself. I'm walking around, maybe wearing a mask or not, and I'm encountering somebody who is not vaccinated. I can infect them and not even know it.
Exactly, which is why me as a virologist that is fully vaccinated, I'm wearing a mask all the time. If I have any exposures, if I ever had any symptoms, I would be testing because I know that there's still a chance that I could get the virus and spread it to other people. And I know that there are a lot of people in the community that are not fully protected yet.
Wow. Okay. We just
see, that's one thing about
we have. Almeda?
I was saying we have back to school coming up. I said we have back to school coming up.
Right.
And the American Pediatrics Association recommended that children ages 2 and up wear masks. But the CDC has recommended that they don't wear masks. So it's going to all depend on, I think that every family should have that conversation with their child and decide on what's best and say, this is what, this is what we as a family are going to do and make these things happen, because the infection can spread when the kids come home, and then you have the high school kids. They're going to be kissing and whatever, hugging, and they're going to think they're immune. They're not going to get it, even if they get the vaccine. And then they're going to spread the Delta variant, because kids are going to be kids and teenagers are going to be teenagers, and the hugging and the kissing at school is still going to happen. So you have to have something in place to protect everyone else, and talk to them and just be real with them. Let them know, just because you're vaccinated, that doesn't mean that you're not going to catch this from Billy Bob or Susie Q, who you're kissing at school, or hugging up on, or riding on the bus next to, so, and that should be considered.
So are you recommending that children wear masks to school?
All of my grands, I recommend that they wear masks to school. I do. Because,
how about anybody else? Anybody else on the panel?
I recommend it, absolutely, because with children, children under 12 aren't even eligible to get the vaccine right now. And we know that there's that perception that children, especially young children, are not at risk of severe COVID disease. And it's true that children don't get infected as easily, and often they present with much more mild disease. But we do know children can have severe disease, and children can also develop long COVID. And this long-term symptoms, I mean, it's, 7-8% of children can develop symptoms that last 12 weeks or more and can be really debilitating. So this is, there's a real risk, and things as simple as masks and ventilation can make a huge difference on the transmission.
Absolutely.
Wow, that's good to hear. And you mentioned a concept I never heard of before. You call it long COVID. So long COVID is when you get COVID and it just doesn't go away in a week. It's 12 weeks.
Basically, it's basically that you get COVID, you have the disease right away, and it can be a severe disease or it can be a very mild disease. And then you get these long-term symptoms, and sometimes they're very different from what the initial disease is. They can change over time, and they can last many, many weeks. I mean, there are a lot of COVID patients that have symptoms that have lasted over a year and can dramatically impair quality of life, ability to return to work, just huge impact across the board. And this can occur to adults, but it can also occur with children.
Wow. Thank you so much for explaining that. So Elizabeth from HealingX, Dr. K, I look her up. Hey, Elizabeth. She said, she's a question. Does the Delta variant symptoms start different from the regular COVID strain? Anyone?
So there's a little bit of change, but not a lot. Overall, the symptoms are very similar. There's a slight change in the likelihood of getting certain classes of symptoms. There's a little bit more sort of cold and flu type symptoms, perhaps slightly less of the loss of smell. But overall, there's very similar categories of symptoms. And if you're feeling any of these sort of general symptoms at all, it's worth getting the test and making sure, because people can present with a wide range of symptoms.
Okay. So this is for nurse practitioner and or Marek. Where do we still, because I when COVID was hot and heavy, there was testing sites everywhere, right? Where can people get tests at now? If I'm getting symptoms, so 2 questions. 1, where can we get a test at now? And 2, how do I know the difference between I got a cold, and maybe I need to go get a test?
Well, actually, if you come into my clinic and you have cold symptoms, and just say if you have allergy and cold symptoms, and you usually get allergy and cold symptoms, and what you're taking is not getting rid of your allergy and cold symptoms that you normally take. Every year you get allergy and cold flare up at a certain time. I give you XYZ, it works, and you get better. So we've done this and you're not getting better. So I'm going to ask you to get a COVID test. That's
Okay.
the thing. I'm going to ask you to get a COVID test because the symptoms can be subtle and then they can be so. I mean, some people come in with just a headache. And I said, have you had the COVID test? And they said, no. I said, well, get the COVID test because we tried Tylenol. You know, there's nothing wrong and anything else going wrong. We've done the sinus thing and there's nothing going wrong. You need a COVID test. Symptoms don't go away. They don't go away as usual and they don't go away easy. I always recommend a COVID test for sinuses, fever, congestion, cough, sore throat, headache. Those symptoms, if they're persistent, you have to get a COVID test.
Wow. And Maret, so where can we get that from? Are you guys still testing at Carousel?
So yes, right now, currently, you can go to any care South Carolina. You can get a rapid COVID test, and you can get a PCR test too if you request it. Mobilely, right now, if you're in the Dillon County area, we're out every day in our mobile units doing testing. You can look at our website, or you can look at our website for information on where we're going to be testing that in a particular week. Or you can also contact our call center by calling any Care South Carolina um, phone number. It goes to our call center, and they'll be able to tell you exactly where we're testing as far as mobilely. But every site we provide a test. You can walk in any site. You don't need a appointment. You can just walk in, get tested. And like I said, and you walk in the site, they're rapid, 15, 20 minutes. They'll have your results and let you know what your test status is. So, yeah. So currently, Marlboro County, Dillon are doing mobile testing. Lee County, Darlington, and Chesterfield are doing mobile vaccines.
Okay. All right. Well, thank you so much for that. And in Marion County, I know you can go to DHAC right off of 76. They have big old sign over there. They're doing testing there. Another question that came in, and it is it true that we can find out if the vaccine? And if so, how can you find out? Come off of mute when you guys want to answer that question.
Okay.
So, please go ahead.
I was going to say they can take the antibody test to see if they have antibodies against COVID.
But do we have to? Is that necessary?
You don't have to. It's not mandated, no. That's only if you want to know, does your body have COVID antibodies?
And the vaccines are very good at building these antibodies in people. There's, if you're worried, the antibody test works very well for that. But, it's for the vast majority of people, the vaccines work extraordinarily well in building antibodies.
Mm-hmm. Mm-hmm.
And so the complete and full immunization, though, or what's it called? Full vaccination is 2 shots in 2 weeks, right?
Right. 2 weeks after the last shot.
Yeah, unless you take Johnson & Johnson. I took Johnson & Johnson. It was 1 shot.
You didn't have to wait it was 1 shot in 2 weeks. It was just 1 shot.
1 shot and I'm done.
Just 1 shot.
Okay.
But you do need to wait. You do need to wait that period of time after the shot also, because your antibodies take time to build.
Mm-hmm.
Yeah.
So you get Johnson & Johnson or Janssen, the brand name. You have to wait. You take 1 shot, you wait 2 weeks. Or if you do Moderna or Pfizer, you take 2 shots and you wait 2 weeks. And with Moderna, nurse practitioner Almeda, can you tell us the time frame between first and second shot?
For Moderna, it's 4 weeks between the first shot and the second shot, and for Pfizer, it's 3 weeks.
So let's say if somebody is at home right now, they took the first shot 2 months ago, they haven't taken the second shot. Is it too late?
No. CDC says it's never too late as long as you get fully vaccinated.
Okay. All right, so let me see any other questions out there from the audience. This has been great. I appreciate your participation today in answering these questions, and hopefully we've been able to debunk some myths. And guys, you're hearing from the experts. So, any last words from anybody on our panel?
I have last words. I just want to make sure everybody knows about our health fair that's going to be in Columbia on the 24th, this Saturday.
Do
So,
tell.
yes. So if you find yourself in Columbia, or if you know people in Columbia, please come by. Tell them to come by. It's on this Saturday from 10 to 3 at Bethlehem Baptist Church in the Greenview community. And we're going to have music. We're going to have free food from a food truck. We're going to have like demonstrations. We're going to have raffles. We're raffling off tickets to see the City Girls and Lil Baby.
I know about City Girls. Okay.
Yes. Raffling off those tickets. If you get vaccinated, you can, put your name in the raffle. And we are raffling off meal plans. There's going to be a vegan food truck out there, and they're raffling off meal plans. We're going to have gym memberships raffled off, as well as photo shoots. So these are all some really exciting raffles. And
the gym membership photo shoot, right? So if you win one, you got to take the gym membership first.
Yep. Yep. And then get your photo taken.
That part.
or you can just get your photos taken as you are.
That's some good idea.
So we're gonna have a good time. I'm really excited about it. And we're excited. It's ads are gonna be running on the radio, and it's
sounds like
great.
fun. Sounds like fun.
Yes, it does.
Yeah.
So I'll be taking that trip up there. I'll see you. And I love, my favorite is The Baby, but I love the City Girls.
I love the City Girls too. And I wish it was The Baby. Yes. Hot Girl Summer.
Okay. Anybody else?
Look, we're calling it the healed girl summer. we're getting healed from COVID.
That's right.
That part. We should claim that. We should go ahead right now so nobody else uses it. Right? We're gonna call Healed Girl Summer.
Mm-hmm. That's right.
All right, panel. You guys rock. You have been great. One of our Facebook users, I gotta put this up here for you all. She says great information. So thank you so much. And I will be back in touch with all y'all really soon.
Absolutely.
Sounds great.
Absolutely.
Thank you.
Thank
Don't wait,
you.
vaccinate. You're on mute. You're on mute.
You're on mute.
Okay, I'm off mute now. Thank you guys for sticking with me while I went off mute. Thank you so much for telling me that I'm on mute and I had no volume. So, hey, what I was saying is thank goodness for this magnificent panel. They provided great information. These are the experts. These experts are working every day. This is what they do. This is what they do to keep our community safe. So I pray that you take heed to their information. It is now time to find some place for you to go ahead and get your vaccine. And the We Care Coalition, our next date is going to be August 7th. And if you go up to Columbia with me for that great celebration on this Saturday, they will have vaccinations at the health fair. So until next week, I pray that you all have a wonderful, wonderful week. And I'll catch you next week on Mondays with Miko. Bye, guys.